Thank you, Dee. I'll just say off the bat that Rab actually did most of my trade union education, so if this is dreadful, the buck probably stops with him. But no, thanks for having me. I'm just going to go through kind of a whistle-stop tour of how we got to the point we're at with regards to decon, and unless you've been living under a rock for the last few years, you'll probably be well versed that there is now a link between firefighting and cancer. So we'll go through a bit of that. We'll talk about the next steps and our demands of the government and our employers, and then we'll also do a bit on mental health as well, which is a project that's just kicked off this week, actually. So, a kind of timeline that's got us to the point we're at now with regards to decon. Back in 2019, the Fire Brigade Union approached world-leading toxicologist Professor Anna Steck at the University of Central Lancashire and commissioned a study on the link between firefighting and cancer. Now, this work was commissioned by the Firefighters Lottery, which is paid for by firefighters. So if you just think about that for a moment, the work to try and keep firefighters safe and the research paid for by firefighters, it's difficult for me to comprehend, but there we are. So Anna's then started the work, and we ended up in 2020 with the interim report. Now, the interim report had only so much information in it available because we didn't have that much data on firefighters and their health. So it was using a kind of catalogue of things, predominantly Scottish death certificates, which were better than the rest of the UK because we actually have historical employment data on it, and a mix of that, sickness records and things like that. We were able to actually figure out what was underlying within our profession. 2021 we launched the Cancer and Disease Registry, so that's for firefighters in the UK, and it's just a big database of information where all firefighters register, and then if they do end up with a diagnosis, they update the register, and we've got real life information on the situation within our ranks. 2022 was quite a big one. The World Health Organization classifies firefighting as a carcinogenic Group 1 occupation, meaning that firefighting can cause cancer. We take it further than that and suggest that firefighting will cause cancer. But that was massive for us. That means it's now written into European law. Obviously, without being part of EU, it was a concern whether it was going to transfer into the UK. But we're certainly making progress in Scotland, and are told there are conversations ongoing at Holyrood with regards to how we apply that and presumptive legislation that I'll touch on later. 2023, the full report was published. Now, the interim report had stuff in it like it talked about how the body permeability rate increased when it was warm with regards to how we absorb toxins, and I'll talk about that again in a little while. It also spoke about the actual link between firefighting and cancer, but we didn't really have the statistics and the figures. So when the report came out in 2023, it was pretty damning based on the registry, based on the death certificates, and we then could no longer dispute that there was a link between firefighting and cancer. It talked about a lot of best practice stuff, how to keep ourselves safe, best practice procedures, but it was obviously up to employers around the UK whether they decided to adopt it or not, and it was up to local reps and local fire brigade regions to adopt it if they could push the employers to do so. 2023 we also started a health monitoring trial. That's something that had been absent. Our employers don't routinely monitor our health. You have medical assessments, but with regards to the long-term health effects of our employment, we don't have annual monitoring. So what we did was we tested 1,000 firefighters across the UK for 63 different markers within the blood of heavy metals, cancer-causing contaminants, PFAS, all these different things. And the response from that is still to be published, but the kind of initial considerations are that it's pretty poor. Scotland does not fare well across the UK. That health monitoring trial involved 166 firefighters from Scotland, some of whom were given terminal diagnoses based on what was found through those trials. 2024, the FBU released a GP letter. Now, this was a skeleton document where you could put your name in, it had your profession and the medical codes, and you give it to your GP, which then meant that firefighting was then recorded on your medical records, so that when you went to the GP with a chest infection or what looked like a chest infection, the GP might actually delve further into it instead of fobbing you off with antibiotics, when in fact there could be something more significant. That GP letter is a massive step forward for us, but again, it was FBU led. It wasn't the employers, it wasn't the government, it was us that did that. And this year, the Grenfell Tower report has just been published, and I will talk about that. There's a few slides on that, so I won't delve into that just now. And the actual clinical data from the health monitoring trial will be released within the next month or so, and that's going to be massive with regards to our push in the government for things like presumptive legislation. So that's the timeline. Just a kind of recap on some of the research. I'll just quote it verbatim. Firefighters are significantly more likely to suffer and die from cancer than the average working person. This has been linked to toxic contaminants released during fires. It's now no longer up for dispute. And then there's a little bit more about the World Health Organization classification to say that there is enough evidence to conclude that it can cause cancer in humans. A little bit about the mortality rate. So mortality rate from all cancers in firefighters aged 35 to 39 is 323% higher than the same age group of the general population, 323% higher. Some of the specific cancers, the list is pretty non-exhaustive, but some of the kind of more significant ones, 2.4 times more likely to develop and die from esophageal cancer than the general population, 3.2 times more likely to die of leukemia, and 3.8 times more likely to die of prostate cancer. These are horrendous statistics. What we're also finding is that firefighters are contracting these diseases 5 to 10 years younger than the general population, which again makes it difficult for GPs to identify these problems because we're not in what they would see as a risk group for these diseases and these cancers. Heart attacks were 5 times more likely than the general population to die from a heart attack, 3 times more likely to die from a stroke, and instances of anxiety and depression are again much higher still. So why are we so at risk? The nature of the role of firefighters brings members into contact with 3 potential areas where carcinogenic contaminants are present. They are fires and their byproducts, diesel fumes, and building materials such as dust and asbestos, which you'll all be familiar with. We find exposure to carcinogens such as benzene from diesel fumes, and then PAHs and VOCs found in smoke. They are polycyclic aromatic hydrocarbons and volatile organic compounds. Do not ask me what they mean. I've got no idea, but they are bad for you, and that's what we're finding in smoke. So some of the other published facts that are relevant and useful for us to note is that cirrhosis of the liver is now linked to long-term exposure of fire effluents. We're also seeing that, as I mentioned, skin's permeability increases with temperature. So every 5 degrees a firefighter's skin increases, the body absorbs 400% more toxins. Your skin is literally sucking this stuff into your body the warmer you get, and that's just 5 degrees. If you think we're going into temperatures of 700 or 800 degrees, you can imagine then what the absorption rates rise to. We're seeing links with pregnancy and breastfeeding from contaminants causing issues from infants, passed down through breast milk and also through the pregnancy. And 4% of the firefighters who responded to the study have already been diagnosed with cancer. So some of the demands of DECON. We demand annual health monitoring. So like I said, we did the pilot project in 2023 with results due imminently, and the push will be for annual health monitoring for firefighters. In America, you are screened every year for these different cancers and diseases. We don't have that in this country, so that is a demand. Monitor and record exposures. Again, we don't have the right mechanisms to do that. At the moment, we'll record the training we used and the equipment we used at a fire, not what we've actually been exposed to. A record of our occupational and health records and death certificates. We've already done that, but the death certificate element across the UK is more challenging. England doesn't do it the same way that Scotland does. DECON policies and training in UK fire and rescue services. Still to this day, some of the employers around about the UK have buried their head in the sand, and they're just not buying the advice. They're not willing to listen, and they're not making firefighters safer. In Scotland, we're in a pretty good place. We've got the Working Together framework. The Scottish Fire and Rescue Service invested an extra £3 million this year into the management of contaminants, and union officials are heavily involved in all the policy procedures and kind of all the work that we're doing to develop the situation in Scotland. We demand facilities and contracts for effective PPE. It's a bit of a double-edged sword. Our PPE is particularly good at protecting us from heat. It's also full of PFAS, which is the next big question. So that's another element we're looking at as well. And we demand presumptive legislation. So using America as an example, in America, if you're a firefighter and you develop cancer, it's assumed that that's an occupational disease, and your employer would have to prove it wasn't, which is impossible to do. In this country, if one of our firefighters develops cancer, they have to prove that it happened through their employment, because the weight of proof is the wrong way around. So that we're demanding presumptive legislation, and I'm told that talks with the Scottish Government are going well, but it's very early days. The next slide basically just says we are committed to Decon RU. What we would ask of you is lobbying MSPs, supporting any social media posts that we have, sharing them, commenting on them. When we attend demonstrations, talk to us about it. It's something we're always happy to talk about. Engage with us and visit your local fire stations as well. Go and find out what the firefighters feel and how they think things are going with regards to their health. So on to Grenfell Tower. 2017, the 14th of June, 24-storey block of flats in North Kensington caught fire. It burned for 60 hours and 72 people lost their lives. It was the deadliest structure fire since the Piper Alpha, and it was the deadliest residential fire since the Blitz. Combustible cladding spread the fire from the exterior to most of the flats and produced large quantities of smoke. We're seeing the after effects of that are now being likened to 9/11, where more firefighters have died since 9/11 than ever happened on the day. This is shaping up to the same. So some of the findings, the Grenfell Tower report from UCLAN was released last month, and some of the key figures. 136 firefighters that were exposed to toxic smoke now suffer with long-term disorders. 136. The reasons for that: a lack of respiratory protective equipment, whether they didn't have it available to them or they then ran out of air after the first BA wear and then went back in. What we also found was a lot of firefighters giving their BA masks to casualties and taking the hit themselves. So there's a number of different reasons to why that's happened. The next slide, 1 in 4 firefighters that were in attendance at the early stages now have life-changing effects, a quarter of all firefighters. Of the 136 that reported life-changing conditions, 66 of those have digestive diseases, 64 have respiratory diseases, 22 have neurological diseases, and 11 cases of terminal cancer. That was reported within the first 3 years since Grenfell. This is going to be quite hard for you to read, apologies. So, firefighters and their effects from Grenfell is just the tip of the iceberg. Who else was affected by Grenfell over the time that it burned? How many police were in attendance without the right PPE? How many ambulance crews were in the risk area? How many civilian staff, whether it's the gas board, the water board, how many of them were in about? How many members of the public, both from the tower themselves and from the surrounding areas, were then exposed to the contaminants? Everybody should be tested for effects from attending Grenfell, and it's just not happening. Some of these cancers can take 25 years to develop, and if they get missed, by the time they do get found, they'll be at end stage, terminal stage. So that's Grenfell. Now on to mental health. It's all fun and games here. Like I just said, this week we kicked off the UK's largest study on mental health in firefighters. We're looking for 10,000 firefighters to engage, and the questions are: how were they feeling, and whether they feel like the employers are doing enough to protect the mental health of firefighters, and the answer is probably going to be no. In Scotland we're very good, but it's always very reactive. We should be doing things more proactively. 60% of fire service workers reported mental health problems back in 2019. Suicide in firefighters is alarmingly high. Just last month we lost a firefighter from the north of Scotland to suicide. So this year we have a big push on mental health at our annual conference, and we'll be leaning on the TUC and the STUC where possible to improve mental health within the workplace. Thank you.